Awesome. Hi, Dr. Yen. Thank you everyone for joining us tonight. This is our second half of TMI Tuesday. This is going to be our English version. And thank you to everyone who tuned in for our first half, our Spanish version with Dr. Yen and Evo. That was a great talk. Now we're just pretty much going to go over the same subject. We did originally want to do, or we were thinking of doing, the upcoming Roe v. Wade ruling. But we decided to lighten it up tonight, do something a little more fun and a little less heavy. We will be talking about the ruling once it comes out, so definitely stay tuned. There is also a live stream on Instagram that we will be doing tomorrow night with Dr. Joni and Esther from Sex Ed Bootcamp, and they will be talking more about the ruling as well. And you can stay tuned for Dr. Yen next week. I think you're going to have one with some special guests as well. So a bunch of live streams coming up. But tonight we're going to focus on approaching hot girl summer, as I like to call it, and how to maintain the optimal vaginal health when it comes to summertime, because it can get different as the seasons go. So I guess, Dr. Yen, what would be your number one recommendation?
Number one recommendation, be it summer or not summer, don't douche. Never, 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 never douche. You can put water, but ideally you don't want to be throwing a perfume or soap into your vagina. You can do stuff on the outside on your vulva, which we're trying to teach people the nomenclature. So the outside, the labia and whatnot, is your vulva. The inside is your vagina. And the way to distinguish is your vagina has wet mucous membranes, which is like the inside of your cheek. If it's wet, don't be sticking stuff up there. On the outside, you can, but be careful, as we were just saying on the previous talk, that you can take some soap, but you don't want to like lather it up because it has natural oils and stuff. You don't want to rinse that all out because then it'll be dry and then you'll be itchy and you'll be like, why? I cleaned it really, really well. You cleaned it too much. So that it doesn't have any natural oil. So touch the soap, touch your outside of your private part, never on the inside, never on the wet mucous membrane. And then the second tip I was looking up, and I was like, I remember there's something about swimsuits, wet swimsuits in the crotch. And so I see it, but I'm like, I don't think anyone's ever done the research studies. So I mean, all of us have, been in a wet swimsuit and air sun dried, right? And I think the key is, I think that you don't like sit around with your legs like this, drying out your crotch. You know what I mean? But if it's a hot sunny day and it dries quickly, you're good. But if it's like 2 to 3 hours with wet down there, then you may be increasing your risk of yeast infection. So yeast likes wet, moist, humid area. And so if you have wet swimsuit down there, maybe not so good. Maybe bring an extra swimsuit to change out, or maybe just change out your clothes. But I'm sure I think a half an hour, an hour should be okay. But like more than that, be aware. So that is a true summer tip.
Yeah, that was like always the biggest, what is it, urban legend when I was at the pool. Like, don't sit in the bathing suit for too long. I know you mentioned yeast infections. So a lot, I think most people are pretty familiar with them, but just explain what that is, what to look out for, and how we can treat those.
Yeah, no, that's a great question. So your yeast and bacteria live in your vagina in harmony. But if you kill all the bacteria, so if you take some antibiotics or something like that, or you feed the yeast with a warm, humid environment, or somehow you have diabetes and that adds sugar to the mix, then you get a yeast infection. And the way you know you have a yeast infection is it's itchy, it's red, and the most clear sign is if your vagina is ejecting cottage cheese. So not like runny discharge, but like chunky cottage cheese discharge, then you definitely have a yeast infection. And you can either go get the over-the-counter treatment, which I think they might have 3-day ovules now, but back in my day, it was like you had to stick cream up there twice a day for 7 days. If you have a doctor friend, call them up, and they can write you for one pill, done. I just feel that's far more civilized.
I saw recently, I think they have even a 1 day, but I've been like hearing a lot of feedback about that. And I think the 1 day is not suggested by um, most
Doctors,
gynecologists and doctors. I think it's just a little too
it's
like
not going to work.
strong and it's
Or
not going to
maybe,
work.
yeah,
So I've seen the 3 and I think 3 and 7. So
yeah,
if
yeah.
you have the patience, definitely do the 7 over the 1.
Yes, yes. Do the 3 or the 7, I'd say, over the 1, because sometimes, particularly as physicians, we're always prescribing antibiotics to kill bacteria, but this
Mhm.
is a antifungal, and you can theoretically develop resistance. So if you like kill half of them, then the other half like,
Mhm.
oh, I know this, I can overcome this, and
Yeah.
then next time it won't work. So you just got to kill it all, and that's why
Yeah.
better 3, better 7, or the oral antibiotic that's 1 day does really work. So
And that is
I believe,
Typhoon? Is that
yes,
Typhoon?
fluconazole, fluconazole,
Fluconazole, yeah.
150 milligrams, I
And
believe,
that can be, um, prescribed
prescribed.
by a doctor, and I'm pretty sure that doesn't isn't it should be covered by most
Yes,
insurance, I'm pretty
it should
sure.
be covered by. I've never seen it not covered, but you may have a copay, you may have deductible. Insurances are all evil now. The last time I did it, I didn't have to pay much. I think my general copay.
That's good. Um, so I know long ago or a couple of months ago, we posted about, it was a natural tampon, and it was a sponge, like a real life sponge.
Yeah,
And I know we were
no.
talking about douching, and sometimes I'll see stuff about like the yoni pearls or whatever. What are your thoughts about the intervaginal cleaning methods?
So we don't recommend steaming your vagina. That's not a normal thing. In no world was anybody ever steamed their vagina. And if you were to do that, there have been reports of people burning themselves. If you've ever had a steam iron, or if you've ever microwave food, opened it and burned your fingers as the steam came out, would not want that to happen to your vagina or your vulva. The natural sponge is literally a sponge from the sea, but the more important part is it has all these little holes in it, which is perfect for oxygen and growing and toxic shock syndrome. That's why tampons have been made, to make sure that when we used to have a ton of toxic shock syndrome, it was because people were like letting stuff grow in their vagina for too long, or having oxygen go where oxygen doesn't belong. Usually oxygen is not in your vagina. And that's like if you are looking in a vagina with a speculum, the walls all come collapsing down on you, and it's like the inside of your cheek, it's all kind of like squished down in there. So you don't want to put a sponge that has holes in it and oxygen and places for blood and bacteria to grow. So definitely do not use a natural sponge. I'm not opposed to organic cotton for whatever you do, though the research has not shown that organic cotton is necessarily better or safer than non-organic cotton for your vagina. But definitely not a natural sponge or
Yeah.
any kind of sponge. Though there is the contraceptive sponge, which is fine, but you don't want to leave it longer than when you need it for that contraceptive. And even then, I don't think anybody can get it. Like they can't make it, or it went off market. It's not dangerous. It's just they couldn't make any more of it, and you can't buy it if you wanted to.
Yeah. That being said, there's been a recent tampon shortage. And I know a lot of people, tampons are their number one go-to when it comes to period products. So what's a couple products you would recommend in lieu of that?
Yes. So what I did some more research on the situation, and it seemed to be a particular brand. So I always do recommend the Pearl brand because it's the easiest, smoothest one to get up there. But the other brands are fine too. So if you can't get Tampax Pearl, then there are lots of other brands. And You by Kotex, I'm sure would love me to give a plug for them. And I'm not going to be paid by anybody. I'm just saying that you can use whatever tampon you want. Do not try to make your own tampon. We've heard stories about menstrual poverty or period poverty, where people couldn't afford menstrual products, and young girls would take toilet paper, put on a pencil, and stick the pencil up their vagina So you do not, because pencil is lead and you can get lead poisoning. You do not stick lead up your vagina. Do not stick a chopstick. Do not stick other things. Mainly because toilet paper can break up and then you got stuff in your vagina again, like a foreign body, like little bits of, the sponge sitting in there, but with toilet paper or Kleenex or stuff. So do not stick that which is not made to go up there. Okay, so no toilet paper up your vagina. All of us have made a makeshift, pads with toilet paper, but that's because outside, not inside. Okay, outside okay, but messy, but inside not okay. But barring that, you could definitely use pads. You can also use period panties. There's so many different brands out there. There's reusable pads, and we were given some free Diva cups at some point. So I have to give a plug for Diva Cup, because anybody that gives us free stuff, we're happy to plug. But also, it's silicone, reusable, green. It doesn't have to be Diva Cup; can be whatever menstrual cup of your choice.
We love the environmentally friendly products. I know a lot of people that use the Diva Cup. I'm team periods optional, so I don't really have to use the product.
Yes.
But I know that the Diva Cup is really cool, and I've been wanting to try out the period panties. It seems like a really cool concept, and I just love the green options that there are, because you never really realize, but if everyone's bleeding so many times a year and they're all using disposable products, it's just so wasteful.
Yes, 10,000 to 14,000 products in our lifetime. And some of us, tampon plus panty liner. And the panty liner is not necessarily compostable. Though I do try to compost the tampon, because it's theoretically cotton and blood.
And they're not necessarily inexpensive either. So
I heard the prices went up crazy.
Yeah, like I said, I'm periods optional. So
Hashtag periods optional.
I have
so yes,
do that, but tell us a little more about periods optional, because I'm totally team periods optional.
Love it. So I realized in trying to get pregnant with my first baby that the only reason those of us bleed with a uterus every single month of reproductive age is we build up that lining and we're like, embryo? Oh, no embryo, bleed. And then we build it up again. Embryo? No embryo, bleed. And we're doing that from 12 and a half to 50. And then most of us in the US are popping out 2 babies. So all those other years are just a waste of our blood, our energy, our hormones going up and down. And I realized every single time I got a period, I got a giant zit. Not into the giant zit. Also trying to get pregnant. I'd been on the pill for so long. My periods had been so light. And then I had a real period. And I was like, oh my God, so much blood. And I was like, is this natural? I don't care. Just get me pregnant. I can't do this blood anymore. And we popped out 2 babies. And then I haven't had a period for the past 12 years, as long as I take my pills. If I forget, then that's when I bleed, or if there are other, complications or whatnot. But my daughters just got their period and they're bleeding for like 7 days. And I'm like, is it done yet? Is it done yet? Is it done yet? And they so as an adolescent medicine specialist, I can tell you that it's totally fine to make hashtag periods optional. The reason my daughters have waited is because we're short Asian people. And so if you throw down estrogen before they've gotten to their final height, then they could lose like an inch or 2 total height gain. But if you are missing work or school, then totally lose the 1 or 2 inches. Or I have one mother, because I'm adolescent medicine specialist, one mother of a daughter, and her daughter's already 6 feet. So her daughter's like, it's fine if I'm not 6'3", And so, and she's really excited about periods optional and actually happy that she's not going to hit 6'3". So 2 years after your first period, you can start making hashtag periods optional. You can do it with the IUD, the implant, where 30% of people lose their periods, 70% get lighter. Each person is different. It just depends on you. The shots, after 3 shots, about 75% of people have no periods. And then with the pill patch ring, The pill and the ring, you can go with no periods as long as you keep taking the medicine. The pill, the only benefit is there's 40 different pills out there. So if one pill doesn't work for you, there's at least 7 other progesterones, at least 2 different levels of estrogen. So a ton of different pills you can try. But with the ring, there's just 2 different rings. There's a 1-year ring and a 1-month ring. The 1-year ring is good if you're 30 and above. If you're under 30, I don't recommend it because the estrogen level's too low. Not good for your bones. And we don't want everybody getting little old lady breaking all your bones. And that's why at Pandia Health, we have expert doctors who know their stuff. And then with the patch, you can go 12 weeks with no bleeding, but a little bit of estrogen is building up over the 12 weeks. And at 12 weeks, it gets to a level where you have risks of blood clots in your chest, your head, other places. So do not go for greater than 12 weeks without a bleed on your patch because the estrogen's building up. And particularly if you're over 35 and a smoker, you shouldn't even be getting any estrogen. But if you're like getting towards 35 or you're a smoker, then those are things to know.
That's awesome. So when I first started my periods optional journey, I am somebody who I get crazy PMS. Like I was the mood swing girl. And that's why I mostly decided I didn't really care about the periods, but the mood swings were just like, it was affecting my personal life. So I started with the skipping my periods, and it was a little bit of a rocky start. I think that I'm lucky that I work for Pandia, so I knew how to do it and I knew to kind of stay consistent. But what would you say to people that are kind of experiencing that breakthrough bleeding? I know you have a little bit of I like to call it the uterus reset method that you do. And I think that's
very good. Yeah. So the example I give, I had a great experiment in my MIT dorm room. So there was 3 of us. One woman every 28 days, then me every 35 days, then our third roommate every 3 months. And she was, because she had polycystic ovarian syndrome. And 1 in 10 women will have that. But you can imagine if you're at every 90 days, very easy to go to no periods. Every 35 days, yes, doable. Every 28 days, harder. And so the 90 days could go probably to no periods immediately. The 35 days I had personally breakthrough bleeding at 3 months. And then the next time I was able to get out to 6 months. And then the next time I was about to get out to 9 months. So if you've used 21 days, 3 weeks of pills, and you're like 45 days or 50 days or 60 days, and then you get some breakthrough bleeding, stop the medication, drop the hormone, do a uterus reset or a clean out, as I like to say, come off of it for 4 days or 5 days or 6 days, your choice. And then on day 5, 6, whether or not you're bleeding, restart the active pills. And then hopefully the next time you'll get out farther. So if the first time you got to 2 months, maybe the next time you'll get to 3 months, the next time you'll get to 4 months, the next time you'll get to 5 months. Again, each person has a totally different pattern and also influenced by the people around you. So like if you're living alone in a room, good. If you're living around like my 2 daughters, 12, 15, and they're having periods, they can infect you. I had a woman who was on an IUD, had no bleeds, and then worked for a chiropractor who's every 28 days, and they spend 8 hours a day together in a close room, breathing on each other, made her bleed. So sometimes the breakthrough bleeding is because you're staying with your, cousin, or you visited a dorm. I've always, on the flip side, on the fertility side, if you're having problems getting fertile, go hang with the 28-day lady. She will cycle you. She will pheromone on you, or go be the house mother of a, sorority or a dorm.
That's funny. So with if they're experiencing the period, the breakthrough bleeding, I know we just talked about the uterus reset. What would happen if you don't do that and you just continued with taking the pills?
If you just continue taking the pills, the way we like to think of it is there's like bricks building up, and then the bricks start to fall, and they just keep falling randomly until you clean it out and build it fresh, new, and stable. And so in the old days, we used to be like, suck it up, just barrel through. But then we did the research, and the uterus reset works much better than barreling through, because you're just going to have all this breakthrough bleeding. And it was a bunch of dudes doing the research, so they're probably like, whatever, just suck it up, as
It makes
opposed
a
to let's try coming off and just dealing with the bleed for 4 or 5 days, but then knowing you can, get out farther. The other thing is, it's really important, the difference between a physician who's dedicated themselves to birth control, studied birth control, rather than somebody who does birth control once a week, every 2 months, or it's one part of many different other things that they do. And so at Pandia Health, we've studied the different progesterones, rank them from most likely to give you breakthrough bleeding to least likely to give you breakthrough bleeding, most likely to give you zits and munchies, but also good for your libido, to least likely to give you zits and munchies, but going to decrease your libido a bit. So it's an offsetting. And so if you're having breakthrough bleeding and it may be you're on the wrong progestin, and you need one with a stronger progestational effect. And so that's the difference between Pandia Health, which has studied and come up with this list that we teach our doctors. If they're having breakthrough bleeding, you can turn up the progestin. Whereas other doctors may not have this algorithm, probably don't, and or haven't studied it compared to us. So don't send us all the crazy patients that have difficult problems. But if you're having breakthrough bleeding, if you want to start birth control pills for the first time, we feel we are the most knowledgeable. We have an 85% retention at a year compared to 55% retention for most people who start the pill. And it's because we start you on the pill that we think are going to give you the least amount of side effects. And you don't even know. You just start and you're like, oh, this is lovely.
Yeah. I have been on a million different birth controls. I always joke with our Pandia team sometimes that when I used to go to the doctor and they'd ask me what birth control pill or what birth control I was taking, I literally would just say the pill. And I thought that it was the pill. Like I thought that was
just
all.
One.
Yeah, I didn't know. I didn't even know. And I couldn't tell you what pills I've been on. But one thing I've definitely learned with working so closely with you, Dr. Yen, is that side effects are not normal. And like, even though we normalize them, because a lot of the times, at least I started my birth control from my primary care doctor, and I started when I was young. So I was dealing with a pediatric primary care doctor. So I think it was always normalized to have birth control side effects, and you might gain weight and you might be moody and you might not feel like yourself. But if you stick with it, it's like all meds. If you stick with it and you find the right one for you, you don't have to live with these side effects. You can feel like your normal self and you can get all the benefits, and not just contraception, but you can wear white whenever you want, and you can be you can lower your chances of cancer, all the stuff that you would use birth control for other than contraception. So yeah, I love Pandia Health.
The other reasons you might want to have a stable hormone versus 3 weeks and then drop are if you have diabetes, because it's all about keeping hormones level. And so if you don't bleed, then the hormone levels are straight. It's the 3 weeks on, 1 week off that is just so dramatic. Also for seizure disorders, again, it's all about maintaining a stable hormone. But acne, I get the North Star whenever, I don't know if it's a drop or the building up or whatever, and I'm seeing it in my daughters. I remember that zit. Yes, it was my friend for
It's
so
always
many years.
the same spot. It's always the same spot.
Well, I think it's because it's the same pore that's hypersensitive to the androgen and just wants to zit out and gross you and all your friends out and fixate on it as a teenager. The other two that are really important is endometriosis. So endometriosis is when you have lining of the uterus in places it doesn't belong. And so you could imagine if you're not on any hormones and it's going up and down, up and down, up and down. And as it goes up, that's not so happy. And as it goes down, maybe not so happy too. But if you just stable, might be good for you. And then polycystic ovarian syndrome, they've actually shown the 7 days coming off was when we had a really high level of hormone. So the pills started at like 130 micrograms, and now the pills are at 30 and 20 micrograms. So it wears off faster. So this 7 days off is too long for people with polycystic ovarian syndrome, probably. And so you should cut it to 4 or 3 days or 0, because during that time, there might be escape ovulation. And whenever there's that risk, then you have the risk of developing a cyst. So I'm telling all my polycystic ovarian syndrome patients to skip that week off because you don't want to risk, or at the very least cut it to 4 if you enjoy bleeding every month. But there really is no reason to bleed every single month.
Wow. That's really great information to know. I would not have known that. So all of our PCOS sisters out there, keep that in mind. That's great to know.
Yes. And we are partnering with PCOS Challenge, which is a national PCOS nonprofit. They do runs to bring awareness to PCOS. They have educational and research funding for physicians, as well as a conference. But it was started by a woman who has PCOS, a husband of hers that has lots of family with PCOS. And so TLDR from Dr. Yen for PCOS, it's birth control to deal with the hormones and metformin to deal with the metabolic. And if you Google Pandia Health PCOS, you can see my Stanford talk on how to manage your PCOS.
Awesome. That's great. We love resources. Definitely check us out just in general if you ever are curious about anything period related. PandiaHealth.com has a gazillion resources. We have a bunch of blogs with great information, all doctor approved. So you're getting legit stuff. And then always, if you're curious about the periods optional movement, check out pandiahealth.com/periods optional. And Dr. Yen's amazing TED Talk about it, which I've watched like 8 times now. It's awesome. So
that's a lot of watching. Now you can give it.
I know. I think I could recite it at this point. But yeah, we are dedicated to making sure everyone learns as much as they can about their own health. So if you're ever looking for a place to start learning, check out Pandia Health. Obviously, if you're ever looking for birth control, also check out Pandia Health. It was great talking with you, Dr. Yen. Are there any last notes you would like to say for tonight?
In case Roe v. Wade gets overturned, which I think it will in the next week or two, and we don't see you all before then, please make sure everyone knows about get their birth control automated, delivered by Pandia Health if you're on the pill or the patch. Otherwise, go get an IUD or implant or shot, whatever method works for you. Get some emergency contraception ahead of time. And I recommend Ella, which is prescription only, but under the Affordable Care Act, no copay, no deductible, aka free. If you have insurance, if you don't have insurance, it's $45, and it works better at every time period. And if it were me, my daughter, my friend, my patient, that's the one I would go with. Know that Plan B and its generics do not work so well if your BMI is 26 or greater, and definitely doesn't work if your BMI is 30. So please check your BMI. Please, everybody, check your BMI before you consider taking Plan B and its generics. You could also double up on the dose, but again, why not use Ella? And then if your BMI is 35 or greater, you can use the IUD, either the hormonal or the copper. Go to ER, and usually they can call an OB-GYN to come do it if they need to, if you need it. And then everybody should know about PlanCpills.org. It's a nonprofit. My friend started it. I absolutely trust her. It has all the information you need to know about medication abortion. 54% of abortions in 2020 were by medication abortion. So not new, not weird, not strange. And it's $150 if you get the medicine ahead of time. But know that it may be coming from India, where all of our drugs come from anyway, so it's safe. Because they're shipping it from India, it takes 2 weeks. And so you can only use it out to 10 or 12 weeks, depending on whatever protocol. So as soon as you miss that period, take a pregnancy test and then keep taking it. And if any time it turns positive, you don't want to get on it, because there are cutoffs. And if you're in Texas, you're literally screwed after 6 weeks plus 1 day. So get it before it becomes illegal. And then last tip is that if you do medication abortion in a state where it's illegal, you theoretically could go to jail or be prosecuted. But know that if you go into an ER, there is no test between a medication abortion and a spontaneous miscarriage, or spontaneous abortion. We actually call that a miscarriage. They can't tell if you had a miscarriage or if you did medication abortion. So don't ask, don't tell, or just make sure that if you're doing medication abortion, you can actually take the second set of pills. There are 2 different pills. You take one now, one in like 12, 24, or 72 hours. The second set you can do in your cheek, or you can do in your vagina. It's shown that you have less nausea if you do it in your vagina than in your cheek. But if you walk into an ER, and they could check your vagina for pills. So if you're going to walk into an ER, make sure the vagina doesn't have any pill remnants if you're in a state where it's illegal.
And if you're curious about the legality in your states, like we said, Plan C Pill is plancpills.org is your one-stop shop for all of those resources. You can learn all about the legality. We never would explicitly tell somebody to break a law, but we also we believe that women's health is not an agenda, it is a right. We believe that abortion is healthcare. So, and we're not going to be quiet about that. So, yes. And you can also, like I said, we have upcoming lives to learn more. We have a bunch of resources. We have a past live with Choice that was super informative. I would definitely recommend going back and checking that out. We dropped a lot of really great resources in there as well. So thank you, everyone. And have a great night.
Thank you, Claire.
Bye-bye.